Imagine trying to push this really thick, viscous honey through a tiny metal tube, like a tube no wider than a single strand of human hair.
Which is, yeah, that's almost impossible on its own.
Right. But now, imagine you have to do that while operating in the most highly sensitive, just incredibly nerve-dense and deeply vascular tissue on the entire human body.
Oh, it is a total physics nightmare.
Exactly. It's the absolute physics nightmare of intimate regenerative medicine.
Yeah, because it's a scenario where you basically have zero margin for error. We're talking about an environment where the physical mechanics of a medical procedure intersect directly with profound psychological vulnerability for the patient.
And that is exactly why we're here today. Welcome to the Deep Dive. For you listening right now, whether you're a medical professional, maybe someone navigating your own health journey, or just an engineering nerd fascinated by how things work.
Like us.
Right, exactly like us. Our mission today is highly specific, but universally relatable. We are exploring the absolute cutting edge of patient comfort.
We really are.
We're diving into a massive stack of medical supply data, clinical guidelines, and product specs from engineering powerhouses. Brands like TSK, JBP, and Mistelli.
Because, the core tension we're looking at today isn't just some minor administrative detail about, like, what's sitting in a clinic's supply closet.
No, definitely not.
We are talking about intimate polynucleotide delivery. The choice of the specific delivery tool is quite literally the difference between a painful, bruising ordeal and a comfortable, seamless recovery.
So we're tackling a very specific question for you today. To optimize comfort and results, should practitioners use micro-cannulas in the 27-gauge to 30-gauge range or ultrafine needles, like a 32-gauge, to deliver these intimate treatments? Okay, let's unpack this.
Yeah, to really understand why the tool itself matters so much, we first have to fully grasp what we are actually trying to deliver into the tissue.
The payload.
Exactly. In medicine, the payload always dictates the engineering required to deliver it.
And looking at our sources, it's clear we aren't just injecting simple saline water here.
Oh, no, not at all.
We are talking about highly specialized, really complex products like Nugen, which is categorized as a bio-revitalizing gel.
Right. It's a prime example of the modern regenerative aesthetic toolkit. Nugen combines 20 milligrams of highly purified polynucleotides.
Which we'll get into in a second.
Right. Specifically PNHPT, which are DNA polymers extracted from male salmon trout.
Wow.
And that's combined with 20 milligrams of non-cross-linked hyaluronic acid and mannitol.
Okay, I want to break down that ingredient list for a second because it sounds like quite a cocktail to the uninitiated. You just mentioned salmon DNA.
I did, yeah.
For anyone listening who thinks that sounds wild, it's actually a massive breakthrough in tissue repair, right? Our sources note that salmon trout DNA is highly biocompatible with human DNA.
It is, yeah, meaning our bodies basically don't reject it as a foreign invader. It blends right in.
Right. And then we've got hyaluronic acid, which most of you listening probably know from your daily face serums. It's an absolute powerhouse for holding onto water and hydrating tissue.
Exactly. And then there's the mannitol.
Right. What does that do?
Well, while it might sound like just a background player, it acts as a crucial stabilizing antioxidant. Because when you inject hyaluronic acid into the body, you have these natural enzymes called hyaluronidases that immediately, and I mean immediately, want to break it down.
So the mannitol stops that.
Yeah, it acts as a biological shield. It protects the hyaluronic acid from breaking down too quickly, which significantly prolongs its hydrating effects in the tissue.
That makes sense. But the clinical data makes it really clear that the actual star of the show here is the polynucleotides.
Oh, absolutely.
Looking at the guidelines, patients are seeking this out specifically for vulvovaginal rejuvenation, particularly for a condition called genitourinary syndrome of menopause, or GSM.
Right, which is an umbrella term for some very, very debilitating symptoms.
Yeah.
We're talking about severe vaginal atrophy, chronic dryness, and dyspareunia.
Which is the clinical term for painful intercourse.
Exactly. To understand why this treatment is so necessary, you have to look at the tissue architecture. Because as estrogen levels drop during menopause, the mucosal lining of this tissue literally thins out.
It just degrades.
Yeah, it loses its elasticity, its hydration, and structural integrity. It becomes so incredibly fragile that just basic friction can cause micro tears.
And looking at the clinical mechanism here, it's clear this isn't just about surface-level hydration, right? Like, this isn't just masking the issue. This payload is actually hacking the body's cellular response to reverse that atrophy.
It works on a profound, just a microscopic level. When these polynucleotides are injected into the submucosal tissue, they initiate this whole cascade of biological signaling. First, they target the fibroblast.
The cells responsible for making connective tissue.
Right, and they upregulate the production of endogenous collagen type I and type 3, as well as elastin.
And it doesn't stop at just building collagen, which is fascinating. The literature highlights that they also activate specific cell surface receptors,
Yes.
specifically the adenosine A2A receptors,
Yeah.
which, if we translate that into plain English for you listening, is essentially like hitting a biological mute button on chronic inflammation in the tissue.
It actively downregulates the production of pro-inflammatory cytokines. And alongside that, the polynucleotides actually stimulate the secretion of VEGF.
Vascular endothelial growth factor.
Right, which promotes angiogenesis.
So basically, the body is being told to build brand new highways for blood to travel on.
Exactly.
New microvascular capillary networks in those blood-starved, ischemic vaginal walls.
And as a final layer of defense, these polymers act as free radical scavengers. They neutralize free hydroxyl radicals.
So they act like microscopic bouncers, just, kicking out the toxic oxidative stress molecules that actively age and damage the tissue.
That's a great way to put it, yeah.
So if we pull all this together for you listening, traditional dermal filler is like stuffing a flat pillow with foam to make it look plump. But these polynucleotides are like sending in a microscopic construction crew to actually repair and weave new fabric into the pillow itself.
Yeah, you are biologically signaling the tissue to rebuild its own native structural matrix. It's just brilliant biology.
And here is the massive physical challenge, and this brings us right to the core tension of our deep dive. You just described this incredible biological payload, but physically.
Yeah.
It's a viscoelastic gel. It's a dense, three-dimensional matrix containing high molecular weight polymers. It is thick.
Extremely thick. It has a high viscosity because it needs to hold its structure once it's actually inside the body.
So pushing a thick, viscous gel into incredibly sensitive, densely vascular, and highly innervated tissue, that presents a major physics
A
problem.
huge one.
How do we physically get that gel in there without causing severe trauma, tearing, and pain for the patient?
Well, that is the exact transition point where medical biology has to rely entirely on mechanical engineering.
Yeah.
And it leads us perfectly to the first delivery option that practitioners use to solve this problem, which is the ultrafine needle approach.
The specs in our sources on these needles are, honestly, they're mind-blowing. We're looking at needles in the 32 gauge, 33 gauge, and even 34 gauge range.
Yeah, they are tiny.
If you are picturing a standard blood draw needle right now, just erase that from your mind. Those are usually around 21 gauge. And in medical sizing, the higher the number, the thinner the needle. A 32 gauge and higher is practically microscopic.
Brands like JBP with their nanoneedles and TSK with their Steroject line are really pushing the absolute boundaries of what is mechanically possible in manufacturing right now. Just to give you a sense of scale, a 34-gauge needle has an outer diameter of just 0.18 millimeters.
Which is wild. I mean, a human hair is about 0.1 millimeters thick.
Right.
So we are talking about a steel tube, roughly the thickness of a couple strands of hair. But I'm looking at these specs, and the math just isn't mathing for me here.
How so?
Well, if the polynucleotide gel is that thick and viscous, a 33 gauge or 34 gauge needle should theoretically require an impossible amount of thumb pressure, right? I'm picturing the fluid dynamics. The resistance in a tube that narrow should be so high that the practitioner's hand would shake, or the plastic syringe might literally crack under the pressure.
And historically, that was exactly the problem that plagued the aesthetics industry. If a needle was made too thin, the fluid simply wouldn't flow.
Right.
The solution to that fluid dynamics problem is an engineering marvel called ultra-thin wall, or UTW technology.
The mechanics of how they achieve that are so fascinating. Our sources point to advanced Japanese metallurgy and a manufacturing process known as micron sharpness.
Yeah, normally when you draw steel into a very narrow tube, the metal becomes brittle. But engineers figured out how to temper and stretch the stainless steel so that the actual walls of the needle are almost unfathomably thin. We are talking about the 0.20 millimeter class of thickness.
To put that in perspective for you, that is thinner than a standard sheet of printer paper. Wow. By shrinking the thickness of the metal wall itself, they drastically widen the inner hollow tube, the lumen, without having to increase the outer diameter of the needle.
And in fluid dynamics, a tiny increase in a tube's radius leads to a massive increase in flow rate.
Right.
Look at the stats for a JBP 33-gauge nanoneedle. Because of that ultra-thin wall engineering, its inner diameter is actually 60% wider than a conventional 30-gauge needle.
So it's a smaller needle overall on the outside, but with a pipe on the inside that is 60% larger.
Exactly.
That completely rewrites the extrusion force equation. It allows those thick, viscous polynucleotide gels to flow through these tiny needles almost effortlessly, requiring only a couple of newtons of force from the practitioner.
Which means the practitioner's hand remains perfectly steady. And from a clinical application standpoint, needles offer one distinct advantage that nothing else can match, which is exact depth control. When a doctor wants to place the Nugen payload into a very specific layer, say just 0.2 millimeters deep into the superficial dermis to repair a localized area of tissue damage, a needle is the only way to guarantee that exact placement.
Our sources mention specific injection techniques they use, like the microdroplet technique or something called nappage, which sounds highly technical, but looking at the clinical diagrams, it essentially means the practitioner is making a highly disciplined grid of tiny injections.
Yes, exactly.
They're placing tiny droplets of the gel about 0.5 to 1 centimeter apart across the entire tissue surface.
It allows for highly uniform superficial distribution.
But, precision aside, we have to look at the glaring downside here for the patient experience.
Oh, absolutely.
If you are making an injection every half centimeter in a highly sensitive area like the vulva, you're essentially turning the tissue into a pincushion.
Yeah, that's the reality of it.
Even if that needle is microscopic, multiple entry points mean multiple pricks. And every single prick introduces a localized inflammatory response, increases the risk of hitting a tiny capillary, and ultimately drastically increases the anxiety for the patient lying on the table.
Yeah, every time you break the skin barrier, you are introducing trauma. There's just no escaping that biological fact.
So if needles guarantee absolute precision, but practically guarantee a certain level of inflammation and anxiety, how did engineers solve the pincushion problem?
Well, they got rid of the sharp tip entirely.
No.
And that brings us to the second highly engineered tool in our deep dive, the micro-cannula.
Specifically, we're looking at the 27-gauge to 30-gauge range for cannulas.
Right. And to really grasp why this is such a game changer, you have to fundamentally forget how a needle works. A needle has a sharp bell tip designed to aggressively slice its way through tissue structures. A cannula is fundamentally different. It is a long, flexible, blunt-tipped tube. And crucially, it's closed at the very end. The gel doesn't come out the tip, it extrudes out of a tiny side port located just near the cup.
I love this analogy we were talking about earlier. If a sharp needle is a sports car cutting a straight, destructive line right through a crowded highway, a cannula is like a gentle snowplow.
I love that.
It's smoothly nudging the cars, or, in this medical case, the delicate veins, arteries, and nerves safely out of the way without ever piercing them.
That physical action, pushing tissue aside rather than slicing it, is what makes it so valuable in a densely vascular area. And just like with the ultrafine needles, the manufacturing engineering behind modern cannulas is staggering.
Take TSK's Steriglide cannula, for example.
Right. They didn't just settle for a standard blunt end.
No, they didn't.
They developed a proprietary dome-shaped tip. When you are navigating under the skin, you are moving through connective tissue which has natural layers or planes.
Right.
The dome shape is mathematically designed to drastically reduce friction. It easily finds the path of least resistance between those tissue planes, meaning the practitioner requires far less mechanical force to guide it. It literally just glides.
And then you have brands like SoftFill with their precision line solving a very different kind of problem. I was reading about their design, and they put a tiny red dot indicator on the plastic hub of the cannula, the part the doctor actually holds, which seems like such a minor detail until you realize why it matters deeply.
Oh, it's crucial because the cannula is operating blind, deep under the skin, and the product comes out of the side of the tube, not the front. The practitioner needs to know exactly which direction that side port is facing so they can accurately fan the polynucleotide gel into the correct tissue layer.
That red dot tells them exactly where the payload is flowing under the surface. It just completely removes the guesswork from a blind procedure.
It does.
So clinically, how is the cannula procedure actually performed compared to that pincushion needle grid we talked about earlier?
Well, it requires a completely different tactile skill set from the injector. Instead of dozens of pricks, the practitioner starts by using a slightly larger, sharp pilot needle to make one single entry hole in the skin.
Just one single prick for the patient.
Just one. That's it. Then they slide the flexible 27-gauge or 30-gauge blunt cannula into that single entry point. Because the cannula is long, often 40 to 50 millimeters, they can gently guide it in a wide radius under the skin.
Wow.
From that one single puncture hole, they can push the cannula forward, deposit a line of polynucleotides, pull it back slightly, pivot it, and push it forward again. They create a wide, sweeping fan or matrix pattern covering a massive area of tissue.
And the downstream effect of that technique
Mm.
is how it dramatically reduces the risk of the most dangerous complications in medical aesthetics.
Oh, absolutely.
Yeah.
Because it's a blunt snowplow pushing structures aside, the risk of bruising and hematomas just plummets. But more importantly, it practically eliminates the risk of vascular occlusion.
For anyone unfamiliar, vascular occlusion is the ultimate nightmare scenario in these procedures.
It really is.
It's when a sharp needle accidentally pierces an artery, and the practitioner injects a thick, viscous gel directly into the bloodstream, which instantly blocks oxygen flow to the surrounding tissue. In a dense capillary network like the vulva, avoiding occlusion is paramount. The blunt cannula simply bounces off the artery walls instead of piercing them.
It's an incredible safety profile.
So we have these two incredible, highly engineered tools sitting on the tray. On one side, the 32-gauge ultra-thin wall nanoneedle for exact, pinpoint, superficial precision.
Right.
On the other side, the 27-gauge to 30-gauge micro-cannula for broad, trauma-reducing, single-entry glide delivery. Both are absolute marvels of modern manufacturing.
So when we synthesize all this data from our sources for you,
Yeah.
which one actually optimizes patient comfort during an intimate polynucleotide procedure?
Well, the answer is that it isn't a binary choice.
Of course not.
It ultimately depends on the highly specific goal of the treatment, the exact anatomical needs of the patient, and their personal pain tolerance. Let's actually weigh the lived patient experience for both. What is it really like to undergo the needle route?
For patients who need very targeted superficial epidermal or dermal repair, let's say they have specific localized scarring from childbirth or maybe severe focal atrophy in one specific spot, the 32-gauge or 33-gauge ultra-thin wall needle is unparalleled.
Because you need that precision.
Exactly. The practitioner has to place the gel exactly in that damaged microenvironment.
But you might be wondering how a patient tolerates 30 individual injections in such a sensitive area.
The reality is, with a high-quality topical numbing cream applied beforehand, the actual physical prick of a 32-gauge nanoneedle is barely perceptible.
Really?
Yeah, patients often describe it as feeling like a tiny mosquito bite or just a slight tapping sensation.
Okay.
However, you can't trick the immune system. Because you're making multiple physical punctures, the post-treatment inflammation, redness, and swelling will naturally be slightly higher for the first 24 to 48 hours as the body responds to the microtraumas.
Okay, so that's the needle side. What is the patient experience like on the cannula side of the equation?
Well, for broader tissue rejuvenation, overall hydration, and restoring large-scale structural support to the entire vaginal wall, the 27-gauge to 30-gauge cannula is vastly superior for overall physical and psychological comfort.
Even though the metal tube itself is technically wider than the microscopic nanoneedle.
Yes, because the patient is only experiencing that one initial pilot prick.
Oh, right.
After that, as the cannula glides under the skin, separating the tissue planes to distribute the Nugen gel, the patient doesn't actually feel sharp pain. The deeper submucosal tissue doesn't have the same type of nerve endings that register a blunt tube as a cut.
So what do they feel?
Instead, patients usually describe a strange pushing or a dull pressure sensation. It feels deeply weird, but it is rarely described as painful.
And the recovery timeline.
Oh, significantly shorter.
Yeah.
The massive reduction in bruising, vascular trauma, and tissue tearing means the patient can resume their normal daily activities and their intimate life much faster.
So what does this all mean for you? It means the medical aesthetics and regenerative gynecology industry is undergoing a massive necessary shift. We're realizing that having a miracle biological payload like polynucleotides simply isn't enough.
No, it's not.
The mechanical delivery tool is just as important as the biological treatment itself.
Because the best biological cellular signaling in the world won't matter at all if the patient is too traumatized by the delivery method to ever return for their necessary follow-up sessions. Patient comfort dictates clinical compliance.
Let's recap what we've unpacked today.
Mm-hmm.
We set out to find how to optimize patient comfort during the highly sensitive process of intimate polynucleotide delivery.
Mm-hmm.
We discovered that whether a practitioner opts for the pinpoint, microdroplet precision of a microscopic ultra-thin wall 32-gauge nanoneedle Or they opt for the trauma-reducing single-entry snowplow glide of a 27-gauge to 30-gauge micro-cannula. Modern engineering is stepping up to the plate.
It really is.
It is making these vital procedures safer and more physically comfortable than they have ever been in medical history.
We are quite literally watching advancements in Japanese metallurgy and fluid dynamics reshape the subjective human experience in real time.
Which leaves you, our listener, with a final thought to ponder as we wrap up today.
Yeah.
As engineering pushes needles to become so microscopic that they barely register on human nerve endings, and cannulas are designed to glide so effortlessly through our anatomy without damaging a single capillary, we are rapidly erasing the pain barrier that has always been associated with medical procedures.
It forces us to ask entirely new questions about the future of clinical medicine.
Exactly.
Yeah.
If highly sensitive regenerative treatments, like fundamentally repairing the molecular structure of intimate tissue, soon feel no more invasive or painful than applying a topical night cream, how will that change our society's psychological relationship with medical interventions?
Right.
If the pain goes away, will the boundary between our daily, casual wellness routines and highly clinical medical procedures just, well, disappear entirely?
It's a fascinating cultural shift to consider. When the instinctual fear of the needle is finally engineered out of existence, what remaining barriers to optimizing our health are left?
Something to chew on the next time you look at a supposedly simple medical syringe. Thank you for joining us on this deep dive into the engineering of comfort. Keep questioning the science behind the surface, and we will see you next time.